Hi, everyone. Thanks for your kind invitation and thanks for participating in this conference. My name is Dr. Michele Antonelli. I'm a physician and a researcher, even in the field of balneotherapy and thalassotherapy, and in general in the field of integrative medicine. This presentation will be about marine climate and health, scientific perspectives, and therapeutic potential. I will try to delve into this topic with scientific evidence and trying to somehow give you some indications about it. So, what is marine climatotherapy? So, when we talk about climatotherapy, we indicate the so-called therapeutic use of specific climates. So, here we talk about marine climate conditions, so exposure to coastal environmental conditions. And key components are sunlight, marine aerosol, so the air, seawater, sand, and mud. And marine climatotherapy can be used for mostly for health promotion and disease prevention, and in some cases for the therapeutic approach of some disorders. Of course, we talk about integrative medicine. So, marine climatotherapy is not an alternative to standard care. It's a sort of integration, it's a complementary treatment. So, sunlight and marine aerosol exposure are part of marine climatotherapy. Seawater immersion is optional. Sand and mud baths are optional. So the main therapeutic modalities of marine climatotherapy are, as I told you before, thalassotherapy, which is seawater immersion, then psammotherapy, hot sand baths, heliotherapy, so controlled sunlight exposure, and marine climatotherapy, air and climate exposure. So we will focus on heliotherapy and marine climatotherapy. So the two main components of marine climatotherapy sensu stricto. If we want to draw a sort of historical perspective, the use of seawater is well known since ancient Egypt, and even Hippocrates defined the environment as a determinant of health. Um, in the past few years, in the past few decades, the environment has been rediscovered as a sort of active therapeutic agent. So, not something passive which surrounds us, but something which can be actively used for therapeutic purposes. And there are, of course, several biological interactions between us and the surrounding environment. In this case, the marine environment. Key locations for thalassotherapy and marine climatotherapy are, for example, the Mediterranean basin and the Black Sea, the Baltic Sea, the Canary Islands, California, and the Dead Sea, which is a unique model because of lower UV radiation, higher atmospheric pressure, and increased oxygen availability. So these are sea or sea-like environments which are often used for thalassotherapy and marine climatotherapy. The benefits of sunlight exposure are several. So, sunlight exposure can help with vitamin D synthesis. It is important for circadian rhythm regulation. It's fundamental for mental health improvement, immune modulation, and of course, sunlight exposure can reduce the overall mortality risk if compared with strict avoidance of sunlight. So sunlight is a source of life, and it can help boosting our immune system and our psychophysical well-being. This is important to underscore. Here are some clinical indications for heliotherapy, which is controlled sunlight exposure. For example, skin diseases such as psoriasis, eczema, vitiligo, and then even chronic pain such as that in fibromyalgia, low back pain. There are also benefits for patients suffering from neuropsychiatric disorders, for example, mood conditions such as depression or even sleep disorders. And it can be helpful even for endocrine conditions such as vitamin D deficiency. Treatment protocols highly vary depending on the specific health condition. Here are some examples, for example, for psoriasis, for depression, for vitamin D. And we must also consider the skin phototype in order to recommend the best treatment protocol. There are also, of course, safety considerations. For example, risks of heliotherapy can be the increased risk of skin cancer, photoaging, photosensitivity reactions, especially if patients, for example, take specific medicinal drugs. And there are also contraindications, for example, subjects at higher risk of skin cancer or those taking photosensitizing drugs, as I told you before. So it's very important when heliotherapy is recommended and administered that there is medical supervision. So there is a sort of a medical checkup, and then the exposure should always be controlled, and patients should be well hydrated and protected during the exposure. So we also have biological effects of marine aerosol. So marine air composition is quite heterogeneous. So there are non-biogenic components and ions, for example, sea salt particles, such as sodium, chloride, iodine, bromide, and so on. There are also biogenic volatile compounds, mostly released by, for example, coastal plants and so on, such as limonene or pinene. And these compounds are influenced by the environmental temperature, by wind, vegetation, and so on. So marine air composition can have anti-inflammatory effects on the airways, can have an antioxidant activity. It can help with reducing stress levels. So even it can reduce, for example, cortisol levels. It can boost the immune system. And there are potential benefits for respiratory diseases and mental health as well. There are some clinical applications, for example, respiratory diseases such as COPD, asthma, rhinosinusitis, so mostly chronic conditions associated with inflammation. And then there are also cardiovascular conditions. So marine environment exposure can be helpful for cardiovascular conditions because of improved oxygenation, and for mental health, for example, stress, mood disorders, and so on. Then ENT disorders, mostly associated with chronic inflammation and immune support. So in order to improve these benefits, coastal environments should be well planned to preserve airflow, to limit over urbanization of coastal areas, and even to enhance green coastal areas. The benefits should be benefits of a well-planned urban area along the coastline can be reduced urban heat islands, improve air quality, and increase exposure to beneficial compounds of the marine environment. And here are some brief conclusions. So, marine climatotherapy is a multifactorial intervention. So, it does not depend on one factor or one modality. And there are some benefits. For example, people with chronic skin, respiratory, cardiovascular, and mental conditions can benefit from climate. From exposure to coastal climate and to marine elements. And there are the effects are enhanced by repeated exposure programs. So programs in which the individual is exposed to the marine environment not only once, but twice, three times, four times, and so on over the months. Just like traditional balneotherapy with hot spring water, highly mineralized hot spring water, even thalassotherapy should be administered once to twice a year, generally to have more sustained benefits. And then it's generally safe with proper precautions that we have seen before, but there is a strong need for more clinical trials, standardized protocols, and long-term outcome studies. So these should be very useful to improve the existing body of evidence about this very interesting topic. So here you have some references and you can find some more information here. So I particularly recommend reading the second reference, so climatotherapy and the marine environment in volume 2. So it's a book chapter of this book, volume 2, Thalassotherapy and Cosmoceuticals, in which I talk about this topic in more depth. So I would like to thank you very much for your kind participation and for listening to this intervention. Thank you again for inviting me.